Welcome back to the podcast, Surviving Alzheimer's. If you're new here, I'm Terry. I'm the founder of Memory Treatment Advisors and Alzheimer's Survivor. Over the past 6 years, I've been my mother's study partner through one of the Leqembi clinical trials. And through that experience, I've learned more about Alzheimer's than I ever imagined I would need to know. Today's topic is one that doesn't get talked about enough. It's genetics, specifically something called APOE4. This is a genetic variant that significantly increases Alzheimer's risk. Most people have never heard of APOE until they're sitting in a doctor's office, faced with a diagnosis or a family history that makes testing suddenly relevant. So let's break this down a little bit more together. What is APOE4 and who should get tested? What do you do with the information once you have it? And how do you live with this knowledge, both the fear and the hope? Let's start at the beginning. What exactly is APOE? APOE stands for apolipoprotein E. I know it's a mouthful, but basically it's a gene that helps transport cholesterol in your bloodstream. Everyone has this gene. You inherit 2 copies, one from each parent. There are 3 main variants: E2, E3, and E4. E3 is the most common form, and it's considered neutral for Alzheimer's risk, meaning it doesn't increase risk or decrease your chances. E2 may actually lower your risk, and that's the good one. And then there's E4. E4 increases your risk, and if you inherit E4 from both parents, meaning you're an APOE4, that risk goes up dramatically. Studies show that people with APOE4 have anywhere from a 60 to 80% lifetime risk of developing Alzheimer's disease. I'm going to say that again because it's important that you understand the significance. You would have between a 60 to 80% chance of developing Alzheimer's disease. And you compare that to the general population where there's a lifetime risk of only about 20%. That's a massive difference. But here's what's important to understand. APOE4 is not a guarantee. It's not a death sentence. It's a risk factor. It's a significant one, yes, but there are people who carry 2 copies of E4 and never develop Alzheimer's. And there are people with no E4 copies who do. Genetics loads the gun, but it's the environment and your lifestyle that pull the trigger. Now, if you do carry APOE4, there are some specific things that you need to know, especially if you're considering treatment with drugs like Leqembi or Kisunla. APOE4 carriers have a higher risk of something called ARIA. ARIA stands for amyloid-related imaging abnormalities. Basically, and this is hard to hear, but basically it's brain swelling or microbleeds that can happen when you're on an anti-amyloid medication, like Leqembi or Kisunla. This doesn't mean that you can't take these drugs. My mom is APOE4, and she's been on Leqembi since 2020. But it does mean that you need a closer monitoring opportunity, more frequent MRIs, and maybe slower dose increases. You'll also have a medical team that's watching very carefully. In this case, knowledge is power, but only if you use it to make informed decisions, not to paralyze yourself with fear. So that's the hard part. That's the science part. Now let's talk about the human side. Claire was 58 when she found out. She joined a prevention study, one of the trials looking at whether we can intervene before symptoms even start. As part of the screening, they tested her APOE status, and she had 2 copies of E4. She told me that she felt like she was getting a letter from the future. She said, "I felt both empowered and terrified." She said, "I think that captures it perfectly because genetic information is a double-edged sword. On one hand, knowledge gives you agency." Claire immediately started following a brain-healthy lifestyle. She's doing everything the research suggests. She's exercising. She's focused on a Mediterranean or mind diet. She's focusing on quality sleep, cognitive stimulation, and social connection. She gets regular cognitive screenings now. She's looking into prevention trials. Claire is taking action. But on one hand, she's carrying this weight, this knowledge that her odds aren't good, that her future might include the very thing she watched devastate her mother. She can't unknow this. And that's the question everyone faces when considering genetic testing. Do you want to know? Some people, like myself, say absolutely. We want every piece of information available so we can plan, so we can prepare, or so we can take action. Other people say no way. They don't want to spend years, maybe even decades, living under that shadow. They'd rather just live. One thing I need you to know is that neither answer is wrong. I will say this: if you're someone who would take action with the information, if knowing would motivate you to make lifestyle changes, to join prevention trials, plan financially and legally for your future, then testing might be worth considering. However, if you're someone who would just worry about being able to do anything productive with that worry, maybe it's not the right choice for you. Only you can answer that question. Now let me tell you about Tom. Tom is 63. He was diagnosed with mild cognitive impairment due to Alzheimer's disease. And when they did genetic testing as a part of his workup, they did discover that he's APOE4. Tom had already made peace with his diagnosis, but learning about his genetic status, and specifically about the increased ARIA risk, made him hesitate about starting Leqembi. He told me, honestly, I wasn't sure if the benefit was worth the risk. But here's what Tom did that I think is so important. He didn't make the decision alone. He didn't make the decision out of fear. He worked very closely with his neurologist to create a customized monitoring program. It included more frequent MRIs than the standard protocol and a slower, more gradual dose as they increased the amount of medication. It was clear communication about symptoms that he was supposed to watch for that really helped open his eyes. He says he went in with his eyes wide open. I think that's the key phrase here, eyes wide open. Tom said that he already had a safety plan in place. Knowing my genetic profile didn't stop me from pursuing treatment. It just meant that we went in with our eyes wide open. This is what informed consent actually looks like. It's not about being scared away from treatment. It's about understanding the risks and the benefits and making a decision that's right for you with a medical team, with your family that's prepared. If you are APOE4 and you're considering anti-amyloid treatment, please don't let the risks scare you away automatically. Please do make sure that your medical team knows your status and is prepared to monitor you appropriately, though. That's the difference between recklessness and being informed. The question everyone asks, should I get tested? And the answer is, it depends. Genetic testing for APOE is not routinely recommended for the general population. The reason is simple. For most people, the information doesn't change what they should be doing. We should all be exercising regularly. We should be eating brain-healthy diets. We should be managing vascular risk. We should be staying socially connected. Those things protect our brain regardless of our genetic status. But there are situations when testing does make sense. One, you have a strong family history of early onset Alzheimer's disease. If multiple relatives developed symptoms in their 50s, 60s, or 70s, genetic testing might help you understand your risk and plan accordingly. Two, you're considering joining a clinical trial, either a prevention trial or a treatment trial, and they will require genetic information as a part of the screening. Third, you've already been diagnosed with Alzheimer's or MCI, and you're considering anti-amyloid treatment. Knowing your APOE status helps your doctor assess your ARIA risk and create an appropriate monitoring plan. Fourth, you're the kind of person who would take meaningful action with the information. You'd make lifestyle changes. You'd plan financially. You'd have legal documents in place. And you're willing to explore prevention trials. But here's what testing is not. It's not a crystal ball. Even if you're APOE4, you might never develop Alzheimer's. And even if you have no E4 copies, you still could. It's not a prevention strategy by itself. Knowing your status doesn't protect you. Action does. And if action is not something you're going to do, and it's not something to do casually, once you know, you can't unknow. Make sure you're prepared emotionally, practically, and with support to receive that information. I also want to address one fear people have: genetic discrimination. In the United States, the GINA law, that's the Genetic Information Non-Discrimination Act, offers protection against health insurance and employment discrimination based on genetic tests. However, GINA does not protect life insurance, disability insurance, or long-term care insurance. So if you're planning to apply for any of those, you might want to do that before getting genetic testing, especially if you're going to get that genetic testing using your insurance coverage at your doctor's office, because you will be flagged by the insurance companies. I'm not a lawyer and I can't give legal advice, but that is definitely something to discuss with a genetic counselor or an attorney before moving forward. Okay, so now you know your APOE status, or you've decided not to test, but you have a family history that concerns you. What do you do now? Well, the good news is there is so much that you can control. You cannot control your genes, but you can absolutely influence how those genes express themselves. Let me give you the big ones. Exercise. This is the single most powerful thing you can do for your brain. Aim for 150 minutes a week of aerobic activity. That's walking, swimming, cycling, dancing, whatever gets your heart rate up. Exercise increases blood flow to the brain. It promotes neurogenesis. It reduces inflammation and helps clear amyloid. That's medicine without a prescription. The next thing that you can do to control it is follow a brain-healthy eating pattern. The Mediterranean diet and the MIND diet have the most evidence. So you get to enjoy lots of vegetables, especially leafy greens, berries. They encourage whole grains, but I would encourage you to limit or eliminate flour. You get to eat fish, olive oil, nuts. You do limit the red meat, eliminate processed foods and sugar. The next one is sleep. Your brain clears waste, including amyloid, during deep sleep. If you have sleep apnea, get it treated. If you have insomnia, address it. But you need to prioritize 7 to 8 hours of quality sleep every night. You should also focus on your vascular health. What's good for your heart is good for your brain. Manage your blood pressure. Keep your cholesterol in check. Control your blood sugar if you have diabetes or pre-diabetes, and don't smoke. The next big one is cognitive engagement. Challenge your brain. Learn new things, a new language, a musical instrument, a complex hobby, do puzzles, read, have interesting conversations with friends. Use it or lose it is real. The next is social connection. Loneliness and isolation are significant risk factors for cognitive decline. Stay connected, maintain friendships, join groups, volunteer. Human connection is protective. I know this can feel overwhelming, especially if you're newly diagnosed or newly aware of your genetic risk, but here's what I want you to hear. These are not punishments. These are gifts that you give yourself. They improve your quality of life right now, regardless of what your future holds. Exercise makes you feel better today. Good food nourishes your body today. Sleep restores you today. Connection brings you joy today. You're not just preventing some theoretical future disease. If you enable those solutions, you're living better now, and that matters. Before we wrap up, I want to talk about the emotional side of this, because genetic information doesn't live in your head. It lives in your heart. If you learn your APOE4, you might feel fear. Fear of what's coming, fear of losing yourself, fear of burdening your family. You might feel relief, like finally there's an explanation for your family history, a reason why your mother developed Alzheimer's at 58 or your grandmother at 62. For me, it was motivation. It lit a fire under my butt to take action and to make some very dramatic changes. Today, I do everything possible to change my odds. You might feel guilt about potentially passing a gene on to your children, but this is guilt that you might be maintaining based on choices you made before you knew. You're probably feeling uncertainty because even with genetic information, you still don't know. You don't know if, you don't know when, and all of those feelings are valid. I would strongly encourage you, if you're carrying this knowledge, to find support. There are therapists who specialize in genetic counseling and the anticipatory grief. You don't have to carry this alone. And remember, APOE4 is not a guarantee. Some people with 2 copies never develop Alzheimer's. The research is moving fast. The treatments get better every day, and prevention trials are enrolling now. Your future is not written in stone. Here's the bottom line. APOE4 carriers face elevated risk and unique considerations, especially when it comes to treatment. But you are not powerless. You are not without options, and you are not alone. Whether you choose to get tested or not, whether you carry E4 or not, the same truth applies. Take care of your brain. Take care of your body. Take care of your heart. Live fully right now, not in fear of what might come, but in celebration of what we have today. If you're navigating these decisions, whether to test what to do with the results, how to manage your ARIA risk with treatment, I'm here to help. At Memory Treatment Advisors, I work with families to understand genetic testing. Together, we weigh the treatment options and create plans that make sense for your individual situation. You can book a free 10-minute clarity call on my website. It's memorytreatmentadvisors.com. Just click on the schedule button or give me a call. You can reach me at 214-924-6102. Thank you for listening today. If this episode resonated with you, please share it with someone who might need to hear it. Leave a review, subscribe, so you don't miss future episodes. And remember, we focus on clarity, courage, and care. That's how we survive Alzheimer's together. Next week's Thanksgiving blog focus on appreciating gratitude amid loss. I'm Terry. Until next week, take care of yourself and the ones you love.